Shalom friends, Aaron here. I want to share some more thoughts about the big news today, which of course is that we have a public health emergency here in the corporate United States. I'm going to share a link to this is sarcasm, pretty awesome site you can go to, the WuhanVirus.com. There you can get live updates, just like your national debt tracker. You can go get live updates on the number of people infected, confirmed cases around the world. You can use your mouse and hover over your mouse. I'm showing my age. You can hover over with your pointer there to your different countries and see what the number is of confirmed cases. You can zoom in on China and check out the different provinces, get live updates on the number of deaths. 11,950 infected, 259 dead, 27 countries. And then you can scroll on down there and you can read the news that's pumped out. If you're subjecting yourself to the never-ending fear, the propaganda, watching television, I don't know what else to say. I'll beat this dead horse until there's nothing left to beat. You got to stop watching television. I mean, you have to do it if you want to wake up. If you want to be able to think straight, get rid of the television. Stop watching it. Don't watch it. The technology is patented to be a weapon against you. It shuts down your critical thinking center. It slows down your metabolism. You have no resistance to it, or little ability to resist, when you're being told over and over and over and over and over and over and over again the same thing. And it has a dramatic effect on you. We have an amazing book called The Way of Herbs. The Way of Herbs. You can look that up. It is an amazing book that tells us all about the powerful medicinal effects that are in the herbs, the plants, the roots, the things that the Father has created for us. And the gentleman who wrote that book wrote another book called The Chinese Way of Herbs. And that's also a fascinating book. We just got that from the library, and then I bought it because as we were perusing it, we found that it was really a worthwhile book to have. And right in the beginning of that book, just today, my oldest son, Josiah, 14 years old, reading that and sharing with me some of the interesting things that he was reading about how we're affected on a physiological level when we're feeling sadness and fear and other things. And it's really powerful information to think about what's happening to us. So I'm trying to stay on point here, thinking about just the fear and the propaganda. So I don't watch television. I read a lot of news. I do very selectively kind of pick out news stories to watch because I want to see how they're presenting it and what they're saying. And then Teresa, I'll share some of that with her. She'll do a little bit on her own, but she doesn't want to be inundated with it. And I kind of filter through it and share with her what's going on without her having to like slog through video after video, article after article, pumping out fear and propaganda. But I just want to tell you that I've been doing a lot of digging, not just into articles that are presented, but also, things from years past. I'm going back 5-6 years and looking into this stuff. And I shared in the first video I made talking about this from The Scientist. I'm just going to talk about it again real quick. Lab-made coronavirus triggers debate. And I'm going to share a video about misinformation, a totally separate video talking about this particular thing, this particular event, and what we're being told about it and how they're, pumping out this idea that, people who are sharing opinions and sharing really powerful information about what might really be going on. Just misinformation. Really powerful video clips I'm going to share with you and some thoughts about that. And so I'm bringing that up because, of course, what's said in the mainstream, which I hate using those words, in the propaganda, is that, of course, there's man-made coronaviruses, and of course, there's patents for that, but that's working on making viruses. Not for this, but for, aviary, SARS-like coronaviruses. And I just talked about how there was a chimeric, they call it, which is parts from other animals. That's what the Chimera is, put together. SARS-like virus, where they were taking parts from SARS coronavirus and piecing it together with another coronavirus from Chinese bats. And I said, you can't make this stuff up. You can't make it up. And we're being told now that, they believe it originated in bats. And this article talks a lot about how this work that they were doing at the University of North Carolina back in 2015, when the patents for some of these coronaviruses that were shared on other channels have come out, that they were building a virus that was more able to infect people. So I'm going to share that link again. It's very interesting reading. Now that article has some information in there, as well as probably 2 or 3 other articles that I read, and a couple of little snippets that so-called experts said in some of the videos that I watched. Now these are just, I'm not even going to bother sharing them. They're 45-minute long, 20-minute long, 15-minute long news programs, and they've got a whole bunch of different experts weighing in, and somebody shares a little something here and there. And one of the things that I've seen come up time and time again, talking about things like MERS, talking about things like SARS, these kind of viruses, is that they're not stable in a sense, and that as they pass from person to person, they mutate. And then it's like this doublespeak, which everything is. It's just like 1984 doublespeak. But they'll say on one hand that sometimes the mutations aren't really beneficial for the virus. And then the virus can kind of peter out and die, right? It kind of not dies, but this epidemic dies, this spreading of it slows way down, and you don't have this big problem. Which I just wanted to mention because, boy, that's pretty anti-evolution, isn't it? Pretty anti-evolution that something as simple compared to the complexity of a human being, like a virus, hasn't figured out evolution yet, and that it can actually mutate as it passes from host to host in such ways that aren't good for it. Isn't that really interesting? But then, of course, to the doublespeak, then in the same article, and this happened in a couple of places, and both in one article, in fact, and then I think one of the news programs I watched, the statement was sort of brought up in the opposite to say that the virus is mutating and that the mutations are good for the virus. They don't use those terms, but what they say is that the virus will mutate, and not necessarily in ways that are more dangerous for humans, because the virus, its goal is to make more virus. Its goal is not to kill the host. And so it's not necessarily going to mutate and become more deadly. In fact, it's more likely not to. Now, that really reminds me of something. You can believe if you want to that you're evolved of monkeys. You go ahead and believe that if you like. It's nonsense. It's absolute nonsense. We are created. And everything else in the world was created by the Father, Yahuwah. He created all of it. Our enemy, and there is an enemy. There is a fallen one, the prince of the air, who rules this earth's systems for a time. He creates nothing. He manipulates and copies. He corrupts and copies. That's all he can do. I wasn't taught in school that there are good bacteria even. I wasn't taught in school that there are good virus, most especially. This is something I had to learn in my late 30s and 40s as I stopped consuming entertainment and started trying to understand the world around me and what I needed to do to be healthy. And I understand now that God, the Father, Yahuwah, created all sorts of beneficial virus specific to the different creatures that he made and to people. And there's nothing new under the sun. Maybe thousands of years ago, this kind of splicing together of creatures, splicing together of even microscopic organisms was likely going on. Just say likely, I think a lot more than likely, but is absolutely going on today and has been going on at least for decades in modern history. So there's nothing new under the sun. Viruses that cause illness in us, that's not the way the Father intended it to be, in the sense that they cause us to die or to have really serious illness that compromises our immune systems and does long-term damage to us. And I'm going to read some things too if I get along to it. But the viruses, in my opinion, and all the looking that I've been doing and the research that I've been doing and reading up on it, are man-made. These are man-made viruses. There was on the north shore of the Lake Pontchartrain in Louisiana, where I lived some time ago, a story about how some virus, I don't even remember what it was, maybe it was Ebola, I don't even care, it doesn't matter what it was, that they were working on in a lab, screwing around with in a lab. And by the way, there is a P4 viral lab in Wuhan, a place where they could actually do this kind of work right there in Wuhan. And there's another one, not a P4, but another lab like this, similar lab in Hubei province, where this whole thing is taken off, which is interesting. Put that together with Chinese bats and SARS being chimeraed together in 2015. Something had escaped out of the lab, but they say it didn't get out of the building. And I've said this before, at the very least, for people to be doing this kind of thing, where something very dangerous could get out and harm us without our consent, without any real protections for us, without us having any word or say about it, at the very least, we shouldn't be accepting of such things. But these virus that are in the bats, the virus that are in the pigs, the virus that are in the birds, your MERS, your swine flu, your SARS, your NCOV 2019, your Wuhan virus. These viruses aren't making billions of birds drop dead. They're not killing all the bats. These viruses are very likely in a symbiotic, beneficial relationship with their host. Much like what I'm going to read about some of the illnesses that we have historically dealt with as kids, children, boys and girls, and that build our immunity. That now we don't have the ability to have our immunity built anymore by having these childhood illnesses. And I'm going to share some really powerful information about that and encourage you to dig into it. But when these things are twisted and manipulated and cut and pasted together to make something weaponized, to make something dangerous for us, as they mutate, not evolve, change, microevolution, not macroevolution, changing from host to host, it seems as though what they do is they kind of revert back to what they were made to do. And that's not be causing deadly harm to the host, and maybe not even really be so infectious to the host that it wasn't meant to infect. Bats are meant to spread to bats, their viruses, and they're not meant to spread to people. And so often in history, if you're willing to just look while you still have the opportunity to find the information, and I like to make this point every time. People say, oh, you get all your information from the internet. Where do you find information from? Where do you find information? There's lots of good information on the internet, and the same people telling you can't find good information on the internet are telling it to you on the internet. They'll tell you the truth. You can't believe everything you see on the internet while you're watching their lies on the internet. But anyway, I'm going to also share with you a clip at the end about how people in Germany, officials, government agencies in Germany, were preparing for a pandemic prior to the outbreak in China. Say it outright. And I'm going to share that with you in a video. And it goes right along with what people have shared happened in Event 201. And I don't get involved in gematria. I've talked to some people who do, and I've paid attention to people who share these things in blog posts and in videos, that you can basically lose the zero and it's 21, just like Agenda 21, 2021, Event 201, how they said 65 million people are going to die when they did a simulation of a pandemic just in October of 2019. And here we are, just a few months later, dealing with this thing. Now, the very same people who will tell you that you can't trust news out of China because everything's on lockdown. Total state-controlled media, which makes me really wonder about the leaked information. I don't know. You know, people saying there's 90,000 infected. I got to take that with a grain of salt because of where it's coming from. Can the Chinese stop that information from getting out? You know, maybe so. I think they could. People saying things like, well, you wouldn't build hospitals if it wasn't really terrible. Look, I've seen so many things. There's so many things I look into. You know that China has whole cities, massive cities, with 8, 10 lane highways that they've built that are empty. If you want to prop up your economy, this fake idea of money, if you want to play that game, have a war and build war machines. Build stuff that you don't need to build. And for a while, it makes your GDP look real good. So a country that builds cities where nobody lives, a country that builds massive malls that nobody fills the stores and nobody shops in, look those things up. Wouldn't build a 1,000-bed hospital for just for the sake of propaganda. I'm not saying that to knock anybody who's sharing this information, because none of us know. And that's the point. We can't know what's going on here on our own corporation that we live in, what was meant to be our own republic. We can't even know what's going on here. But we're going to believe that out of these almost 12,000 infected people across the globe, and where's the number here? Whatever it is, most of them in China. We can trust Chinese numbers. It may be 90,000, or it may be none. We don't know. We just don't know. But I'm going to talk about some real, not solutions, but real ways to be prepared, no matter what. So, if you haven't looked into Event 201, look into it. If you haven't looked into the fact that there are other countries that very recently were preparing for this before this happened, very recently, you should look into that as well. Very interesting stuff. So, why are we trusting the information from communist China? Why are we trusting anything that comes out of China, even its supposed leaks, and basing what we believe on that? I think we need to be careful. I think we need to be careful about what fear does to us. Physically, things happen to us when we're afraid. I'm going to pause this video and find that book and see if I can read that to you. Oh, well, I couldn't find it. Our oldest son, Josiah, probably has it upstairs. Our kids are awesome. I mean, they're awesome. The stuff that they read about, the stuff that they're learning. But we have real physical things that happen to us when we're afraid. Things that really affect our health. And of course, psychological things. We are not able to think straight and make sound and sober decisions when we're afraid. So, number one, look, I don't know what people do if they don't have a relationship with their Creator. I don't know what you do. I'm not afraid. But I am sober-minded. Teresa, my wife, she's not afraid, but she's sober-minded. And we realize that this is something. This is something. I got to tell you that I don't really believe that this man-made, not man-created, man-made Chimera virus. Because I don't care what you think about what I have to say here. I have a right to share my opinion. I have a God, the God, Creator, given right to share my opinion. And if you don't like it, shake your head at me and think I'm an idiot. Don't pay attention. But this whole idea that I can't share an opinion, what's going on in our country today, in our world, taking away our ability to speak. If you're sitting idly by while this goes on, shame on you. Shame on you. I don't know what you'd do if you don't have that relationship with the Creator. But I'll tell you, if you have that relationship with the Creator, you can be sober-minded, and you can pray. You can have communion with your Father who made you, and you can have your fears melt away, and you can think straight and make good, sound choices and good decisions. And so look, if you don't believe that there's a Creator, if you think we're all just happenstance, I can make another video talking about that. But if you think that we're way too amazing and complicated to be a mistake, and we are, this life is about getting to know who your Creator is. And we can know, not think, not believe, but know. And man, that knowing is, in that knowing is freedom that I can explain it to you, but it's like somebody who's lived their entire life in a cave and never seen the sun, walking outside and seeing the sun. You didn't believe you could experience what you can experience. People are terrified about this and they don't want to talk about it. This doesn't scare me. I'm pointing at the www.wuhanvirus.com. Live updates on the virus. I'm going to read a couple things to you. This is from an amazing book. I'm sure it's a misinformation book. The Nourishing Traditions Book of Baby and Child Care. And I shared a little bit from this book. I'm going to read a little bit from this book, and it's very important stuff. This is talking about our immune response to pathogens, to virus in particular. It's in chapter 6 of this book, who was written by Sally Fallon Morell and Thomas S. Cowan, MD. The Nourishing Traditions Book of Baby and Child Care. Vaccines and the immune system. The final and most important issue concerning vaccines is the alteration that occurs with each and every inoculation with respect to our immune system. We know that the immune system has two distinct arms. The first arm is the Th1, and this is called the humoral immune system, which responds to microbial invaders by making antibodies. Now, the adjuvants that they put in vaccinations, they tell you, is to stimulate immune response. It doesn't stimulate your full immune response. It stimulates only this first arm, the Th1. These antibodies, quote unquote, remember which microbes have already been exposed to the host, to the body, in order to give us long-term immunity to those microbes. But the second arm of the immune system, called Th2, or cell-mediated immune system, involves the white blood cells, whose job it is to digest, to gobble up, to grab hold of and eliminate the invaders through various elimination channels available to the human body. It is important to clearly understand that the symptoms that we call sickness stem from the reactions of our own immune function, and only minimally from the microbes themselves. It's our own body that we feel this sickness from, not from the microbes. When we encounter microorganisms in childhood, say the virus associated with chickenpox, varicella, we have no antibody memory of a previous encounter with this virus in the past, and both arms of our immune system mobilize. The cell-mediated arm, the Th2, the second part, digests the microbes while at the same time causing symptoms that we associate with being sick, such as aches and fever to turn up the heat on the virus to kill it. And then the same cell-mediated arm eliminates the invaders, probably, and other toxic wastes at the same time, cleaning out our body of other toxins through diarrhea, rash, mucus, and cough, etc. These symptoms are the cleansing part of the process. You would never hesitate to remove garbage from your house. Similarly, stopping or preventing the cell-mediated response to invaders leaves the garbage in your body, which is obviously a big mistake. As this cell-mediated reaction is taking place, the humoral arm, that's Th1, the first arm, that's the one that the viruses, the antigens and the toxins and the things that are in the vaccines, that stimulated, but the second arm is not stimulated. So the Th1, the humoral, is busy building antibodies to remember the organism that's making us sick. And these antibodies bind with the invading organisms to tell the white blood cells to digest them and get them out of the body, to excrete them. This process is usually completed within 6 weeks, and the child is not only restored to health, but also has exercised his cell-mediated response and cleansed his body. Exercised it, made it stronger. Getting the measles makes you stronger and less likely to get cancer and all sorts of other things, but only naturally occurring measles, not getting in a vaccination, because that doesn't stimulate both arms of the immune system. This is simple science. And I'm not just reading this from a book. I've researched this other ways, but, no matter what, we're not the ones in the lab doing this work. And so you got to pick who you're going to believe. You believe the people who are at the top of their healthcare system are making billions of dollars? Or you believe people, you got to choose who you're going to believe. We all put our faith somewhere. This process is usually completed in 6 weeks, and the child is usually healthier. They've exercised their cell-mediated response and cleansed the body of this particular organism and other wastes as well. Most importantly, the body now remembers what happened, and so he is stronger and more resistant going forward. In fact, not only is the child restored to health, but is likely healthier than before the illness. This is the whole point of natural illness in children. Short-term illness actually improves long-term health. Like a snake shedding its skin, the process involves a certain amount of exertion and may carry some risk, but the key point is that one cannot be a healthy adult without having gone through some of the process we call sickness in childhood. To deny children the opportunity to be sick and then expect health in adulthood is like asking someone to lift a heavy weight without ever having lifted a weight before in their lives. Our immune systems, like our muscles, are built to work, and that work makes us stronger and more resistant. In contrast to this picture, consider what happens when, instead of allowing your children to contract illnesses naturally, we force the experience of the vaccine. Vaccines are designed to provoke as little cell-mediated reaction as possible. That's a fact. After all, cell-mediated reaction is, quote-unquote, sickness. And if vaccines make people sick, it's back to the drawing board to clean up the vaccine. The whole point of vaccines is to provoke memory, humoral arm of the immune system, without provoking a cell-mediated response. That's fact, not misinformation. So, in this book, and others, but this is one I'm going to read out of, Healing Herbs for Women. Maybe I'll read out of it. This is talking about ginseng. Ginseng root has been used as a tonic to improve resistance to infectious disease in traditional Asian medicine for several thousand years. Research studies have confirmed that ginseng root improves immune function by stimulating the activity of the natural killer cells. We're talking about the cell-mediated. That's what we're talking about here. And increasing the production of lymphocytes. It goes on to say here that an article published in Drugs Under Experimental and Clinical Research discussed the results of a study in which the ability of ginseng to improve immune response to the influenza vaccine was evaluated versus a placebo. 227 adult volunteers were given either 100 milligrams of a standardized extract of ginseng root or a placebo daily over a 12-week period. And then all of the volunteers were given an influenza vaccine at week 4. The volunteers taking the ginseng root showed a significantly greater immune response to the influenza than did those in the placebo group. In addition, the individuals in the treatment group experienced fewer cases of influenza and fewer colds than those in the placebo group. Don't be afraid. And if you got to get a vaccine, if you feel like you might have been exposed to something, you got to understand that the Creator has made things to help us be healthy. You've got to stimulate your immune response and feel a little sick so that your body attacks the toxins and the invaders and eliminates them from your body. Because these vaccinations are meant to only get the first arm of the immune system going, creating the antibodies to remember the pathogen, but not to seek it out and destroy it. That's why So many of these young ladies who have had devastating effects from HPV vaccine, they don't have those devastating effects after the first vaccine, maybe not even at the second, but at the third time they've been destroyed by it. I've watched so many and read so many accounts of what people have gone through. You can listen if you want to the alphabet agencies that tell you it's safe, or you can listen to the people who've experienced otherwise. Who are you going to put your faith in? Who are you going to trust? So I think that's it for now. Don't be afraid. But if you're sitting around drinking beers, watching TV, eating Cheetos, you got to change your life. You got to change your ways. We have to repent of our missing the mark. And our missing the mark is that we're not protecting the temple. Take care of the temple. There's a lot of real misinformation out there about what's good and what's bad. And I'm going to share a little bit about that in my next video. Until next time, friends, no fear. No fear. Shalom.
Now, the authorities say they're fairly prepared even before the outbreak, because they were training, they had simulations, and all measures have been reviewed before the first case was detected. And even before the outbreak, because they were training, they had simulations, and but like I said, there were preparations preparations that were ongoing even before the Chinese outbreaks, and they were reviewed before even the first case was detected. Even before the Chinese outbreaks, and